Hello, and welcome to this free webinar brought to you by the Dental Academy of Continuing Education. This webinar is supported in part through an unrestricted educational grant by Rectangle Health. This presentation, Patient Payments Power Hour, will be presented by Michelle Dowden. This presentation is both live and interactive, so you can ask a question at any time via the Ask a Question box in the presentation window. We will answer these questions as we're able during the Q&A portion at the end of the webinar. Information on how to receive your CE certificate through the Dental Academy of Continuing Education's website using this webinar's course code will be supplied at the end of the presentation after the Q&A portion. So please be prepared to write down this information. If you have any technical difficulties during the webinar, just type your issue into the Ask a Question box and a member of our team will assist you. If you are running pop-up blocking software, you will need to disable it in order to view the webinar. In addition, it is recommended that you close down all other applications for better performance. For your convenience, this presentation will be available for on-demand viewing within 24 hours of this live event. A reminder email will also be sent to registrants containing a link to the presentation for on-demand viewing. It will also be accessible from the Dental Economics homepage. Endeavor Business Media is an ADA CERP recognized provider and an approved AGD PACE program provider. This webinar presentation is approved for 1 AGD continuing education credit. Please take a moment to review this slide. Michelle does have a leadership or financial relationship to disclose or related to this continuing dental education activity. Today's continuing dental education activity is supported through an unrestricted educational grant provided by Rectangle Health. Images used in this presentation have not been altered from their original state. Images that have been altered for educational purposes will be fully explained and disclosed to the audience during the presentation. Please take a moment to review this slide. Now, please enjoy the following presentation from Michelle. Michelle, take it away.
Thank you, Brian. Thank you so much, and I'm happy to be here. Thank you for attending today's session on patient payments. I am looking forward to discussing how digital engagement and payment options are no longer simply patient preferences, and now these online, mobile, and contactless methods have really emerged to meet patient expectations and maintain their loyalty to your practice. A little bit about me. I'm currently the Vice President of Marketing here at Rectangle Health, and over the last 8 years, I've been dedicated exclusively to the healthcare community, focused on working with and educating the dental community on how to maximize the revenue cycle and enhance the provider-patient relationship. I honestly believe that sharing these best practices in the acceptance and increase of patient payments through the use of the latest technology and digital tools can really transform office processes for the betterment of both the staff and the patients. I've worked as a relationship manager for major practice management systems over the years, such as Planet DDS and CareStream, Henry Schein. And in my role today, I'm still very grateful that I get to present this type of information through CE courses such as these and other webinars and events. I can't stress enough that it is an honor to be able to talk with you all about how to make sure that your practice is as healthy as you try to make all of the patients that come in and see you. So thank you for that. Today, what we're going to cover is patient payments, right? And we are going to also talk about how we can take technology to the next level in your practice. From a very practical point of view, I'd like to communicate how digital solutions in your front office can help your practice create a smoother experience for your patients before and after they're even in the chair. And by design, it also helps improve your staff and their feelings about how processes are working and how things can be enhanced and improved. I do believe that practices have just begun to tap into the benefits that a technology transformation can have on overall staff efficiency, patient relationships, and importantly, practice profitability. We've turned such a corner over the last 15 to 18 months that I'm excited for you all to hear about how we can continue to build on that. So with that, let me get into the details. I'd like to focus on how to identify and recognize the need for the enhancements of technology, how to prioritize finding the right solution, setting aside the time and resources to implement it. We'll talk about at length how other practices have gone above and beyond and executed upon technology. I think some of the testimonials you'll hear at the end of the presentation will be helpful to you for a point of perspective. We also will talk a lot about statistics that we've done with consumer studies. And, I'll share some firsthand experiences from providers and professionals who completed this transformation and some of their sound and practical advice. So when it comes to patient payment optimization, what we have found is that practices often, and I'm sure you can all attest, are constantly under the competition for priorities while you're running a day-to-day practice and seeing patients. We have found that often it's simply because the current way of doing things is familiar and current system and processes seem to be working well enough. A lot of our dentists will tell us, you know what, we don't change it. If it's not broken, don't fix it. That is definitely something we hear often because the thought of implementing and training staff on new protocols or processes is simply overwhelming. And while practices might get by with the day-to-day and the business as usual, we do realize that they miss out on many of the benefits of enhanced technology. And what we're finding is that there is a major patient loyalty factor that we want to convey to you over the next few slides that will impact your practice in the future. And we're also really hoping to showcase how you can really attract a much healthier cash flow by implementing and working with technology. We did a recent consumer study, and I wanted to share some of the findings with you as we really see that patients' preferences support the desire to move to a digital experience. And when we say digital experience, you can really attribute that to things in your life such as Amazon, Netflix, when you're really not reaching in your wallet to pull out a card, or when you can really do things from your mobile device from start to finish. When we say digital experience, that's really what we're meaning is there's not a lot of intervention physically or manually. Patients want that same experience from their healthcare providers. We often hear that they want to do it like they, are ordering something from Amazon or as easy as it is to subscribe. The ways that we transact in all the other areas of our lives want to be carried over as a patient. And these digital options for payments, for communication, have really become front and center. And the good news for providers is that these things are also good for your practice as they improve efficiency and profitability. And why discussing patient payments during this hour is so critical is that patients are bringing these typical day-to-day experiences and expectations to your practices. And they're increasingly behaving as they would consume any other non-healthcare transaction or service. And what we're seeing is that, as I mentioned, these significant brands like Amazon and Netflix have altered consumer behavior significantly. And as patients increasingly expect their healthcare experience to mirror these retail transactions and interactions, providers must also focus on which stage of the journey that they can consider using more modern communications and payment options. And in this consumer-centric world, patients are also increasingly willing to switch providers to make it even more compelling to consider digital tools in order to enhance their experience. I think to me, that's one of the biggest changes and most the things that keeps me up at night thinking about that there's a generation that will actually consider leaving providers because of the experience with digital or non-digital tools. So when I think about that, that's the levity that these conversations need to bring to light. So for your dental office and the staff, this new digital flow would mean not only inputting and organizing and discarding of large amounts of paper, this would be not using the phone to reach patients for appointments and billing reminders, not manually chasing down outstanding patient payments. I'm sure all of that sounds pretty enticing, and that's not something that has to be uncommon. It really can be something that you can bring into the practice easily and digitally, and we'll go through what that means. So technology really does exist to alleviate pain points that both the patients and staff experience from traditional office workflows, from pre-registration to post-care. Digital transactions and solutions can help smooth out the experience, solve the practice's problem of chasing patient payments and collecting outstanding accounts receivable by making it easier for patients to pay, by extending patient payment options and automating the actual process at the office. So we're going to talk about that next. We often think about the patient journey in 3 steps, and I hope this connects with you as well. We consider that there are the stages of pre-care before they come into the practice, point of care when they're actually physically with you, and then what happens after they leave. And each of these stages come with opportunities to create a positive patient experience and open up the opportunity for patients to make payment. And with technology, we can make all of this seamless. We could make all of this happen without any manual intervention. So we're going to talk about technology's role in each of these 3 areas. We'll start with pre-care. It's a good place to start. The one thing that I think, let's be honest, changed the most and is probably not going to go back is the way our waiting rooms look now. I don't think that many people want to go back to the old way of sitting in a waiting room and filling out forms with paper and pen and a clipboard. I think we've really pivoted to welcome text messages, sitting in the parking lot, waiting to know when I can come in and filling out forms digitally. And we can keep going with that, and we can keep leveraging that. And when we think about how this affects patient loyalty, it becomes even more, I think, important for us to consider that patients are willing to shop around for providers who offer this digital communication and registration process. We are all patients as well as providing care. Submitting our information before the treatment is beneficial for everybody. And when folks can access forms online, I think this really just becomes to serve a new purpose where we're not looking for printers to print it out. We're not asking patients to bring papers in with us so that we're exchanging physical papers. And then even so much easier as a family that if you can fill things out before then and you're not sitting with either your children or your people who are in your care. I think that, again, I'd like to just point out that a lot of the generations that are younger are also looking for this frictionless environment. So these are things that we want to stay and keep working towards even improving so that more and more of our patients use it. Another way to consider a pre-care is to really focus in on obtaining a card on file before they even come to the practice. And also those through that registration form process. With HIPAA compliance, digital patient registration technology, practices can send electronic registration forms that they can fill out from home, even from the car, right before they enter. These links can be sent out through email, through text, and I know a lot of practices have really implemented this over the last year and a half. And I think it's been very surprising how quickly our practices have taken advantage of that. And I'm sure that this was a very big benefit to the staff and how they manage patient flow, and also how it improves the accuracy of patient information. I think that when we consider collecting information digitally, we can easily adapt this to virtual visits as well, where when teledentistry is an option for them. So we've made big strides in that change. I mentioned card on file because I think when we consider Uber or Netflix or Amazon, the thing that is the most compelling about those is you're not digging through your wallet to pull out a card. Everything is done and stored safely in a cloud-based technology solution, so that while you're gathering the patient information digitally, you can also ask them if they'd like to place a card on file ahead of their appointment. And offering card on file up front is a very practical way to start the payment conversation with your patients. And for many providers, revenue cycle management and receiving timely patient payments are major concerns. The traditional payment model for dental providers across all specialties is breaking down, and unpaid and outstanding balances can build up. And part of the problem really is that patients leave appointments and procedures without knowing the balance and without establishing expectations with the providers on how and well they will pay that balance. I don't know how many practices are on the line that send lots and lots of paper statements. Oftentimes, people don't put that at the urgent top of their list. And if enough time goes by, they forget even why they went for the appointment. So the revenue cycle really does stall there. And unfortunately, it's pretty much the norm that people do not prioritize their healthcare bills. And this is why we really do reinforce that storing patients' preferred card methods through secure technology is a practical way for providers to ensure that they can receive payment for services rendered and simplify the walkout or checkout experience. And when your patients have their card on file, it's an ideal way for you to capture revenue and optimize your operational efficiency. So the earlier in the process you can collect their card, which is why we put this at Precare, the better. And again, more and more people are doing this across all lines of their lives. Why not at the practice? And if you implement that electronic registration process, oftentimes you can collect a card on file up front, and then you can essentially, after treatment, have them fulfill any outstanding patient balance without ever having to exchange a physical card or cash or check. Let's be honest, maybe you still have patients doing that. This is a way for you to make everything electronic and contactless. So Precare is also the right time to establish new digital communication ways, right? We've made a pivot, and digital communication is now key to the overall patient relationship. And especially when it comes to creating a satisfactory experience for both patient providers. Practices now are communicating and convening their conversations with patients either through email or by text. And by offering patient-friendly technology options, it's only part of the equation. So we're going to talk a little bit about ensuring how patients can know what their payment options are and when their patient payments are due, so that you can receive timely payments and make patients feel in control of their health care. Part of it is relying upon the office to talk to patients about what the payment process will look like, but also what options are available, what tools they can use, what technology is available to them. And we're going to talk about that as well next. So this shift of opening up new and more direct digital communication methods has such a big impact on practices. And we really see that from an improved cash flow to a strengthened patient-provider relationship. I think this is probably my most favorite slide to talk about. When we really consider how text messaging has changed our lives and how the practice can now communicate with their patients, I share some of these statistics with you in case you're not using and leveraging text messaging. Patients love it. They see it as an efficient way to communicate, and it's not only easy for offices, but it has such a high success rate at reaching patients. 98% open rate for all text messaging, and everyone can attest. I'm sure your phone is sitting right next to you as we speak. And if you were to get a text, you will look at it. You will look at it and you will respond to it within 3 minutes. I think that's on the next slide. I'm giving you a little preview, but it is an amazing communication tool. So it's preferred over phone calls. Many patients report that they don't even listen to voicemails anymore. They have a high open rate, and it allows us to take action right from my phone. And the front office can leverage this by sending text messages directly from their workstation, making this process a seamless extension of your current workflow. So here's a couple more things to consider. So today, technology allows the practices to communicate with their patients, and it's this new channel that's more direct, less time-consuming, preferred. No one, waiting for a call back. Your patients aren't trying to scramble and find time to call you on a lunch hour, which is your lunch hour, or after work when you're not available. So the time spent of making phone calls can continue to decrease in time and effectiveness. And especially our younger generations. These are folks who don't know any other way than transacting and communicating through their devices. So this is something that I implore that you use to unlock this new communication channel, and also is a very personal and unique interaction, which again is something that people are looking for. So I think that on this slide, when I think about truly the number of distractions, when I think about how people are consuming information, and you read that text messages are five times more likely to be read than an email. 98% of text messages are read, 22% of emails are opened, and I would even add how many are really responded to. Sometimes we open them, we don't get a chance to respond. That's just another way of hitting into a dead end. So when we think about what you can use for text messages, it's not only talk about coming into the practice, but there's a personal connection here. So these are some examples that we've seen our practices use with their patients. That these messages are endless. And, sometimes it's nice to feel like there is a personal connection with your practitioner or your provider. So sharing that with you, we've seen some really, really big success rates in this new technology. I'm going to move into point of care payments. And again, if this is unfamiliar, this basically just means when a patient comes into your practice, you have, the traditional check-in and check-out workflow. And when we think about how convenient it is to check out a patient and make sure that the workstations are really able to do everything that a patient needs to do as they walk out, one of our clients has mentioned that ensuring that having the staff able to process a credit card payment at each workstation is very helpful, efficient, and it just helps people to move quickly through the office. And when you employ technology like patient payment, contactless acceptance, you'll really be able to move patients in and out quickly and safely. Patients want that retail-like patient payment experience. And over the last year and a half, it's only strengthened the preference for convenient and contactless methods on both sides of the desk. So to create this experience for your patients, we We offer patient payment devices, and I'm sure you've seen it in your walk of life, when you can just tap and go using digital wallets like Apple Pay and Google Pay. So in addition to accepting a wide range of payments, right, from your FSA, HSA cards to debit to credit, you also want to find a technology solution that will use these contactless methods and add that to your dental practice management solution and checkout procedure. Can't talk about anything these days without talking about what it's like to pay online, right? So for aftercare, so after your patient has left, how easy is it for them to pay? Are you sending out paper bills? And I'm going to ask a really important question is, do you have a way for patients to pay online? Is there a website link that they can click on and go to? Do you have a URL that you can add to your patient statement? Gone are the days of us not being able to pay online. People are really open to it, and they want it as a time-effective way to make their payments. Oftentimes, people are doing their bills late at night or on the weekends. And if you think about your website as an extension of your practice, let's make sure it's open to your patients to interact with so that they can get information, pay, refer others. Your website is a vehicle to carry that vital information to your patients when it's time for them to consume it, so they can be on their device and walking through when you're available, when you're open, how to make an appointment if they have an outstanding bill. So making that content available is crucial. It's likely that people are also searching the web for information at a higher rate than any other time in history. So staying connected with your patients, putting content on the site, thinking like your patient would. And so just so you have another quick point of reference, 95% of web traffic lands and only goes to your home page. 75% of people don't even scroll past that. So make sure that if your website doesn't have a pay now link, and if it does, it's on your home page so people can easily see it and click on it. And giving patients the ability to pay through an online patient portal or your website will easily increase the number of incoming payments at your practice. We heard from one of our practices that when they added in text to pay, they couldn't believe the rate at what they were getting paid, how quickly it was coming through because it was so easy and seamless for their patients. So again, just to give you some examples of what that looks like, I share with you, again, these are not actual messages, but they're examples of messages of ways that you can use text-to-pay technology to offer patients a convenient and digital payment method. So when you send patients a link with their balance information to their phones, you could put the information that the patients need right there at their fingertips. It can go to a mobile-friendly checkout page, and patients can make these payments quickly and easily wherever they are and whenever it's convenient. A really important, this is something that we read about in the news all the time on the payment side, is the idea of patient financing. I don't think this is very new, but what's become very transparent to us is a trend that, I'll talk a little bit about this in the slides, is going beyond traditional methods of collecting payments, that technology can also serve to make it more manageable for patients to pay out of pocket for healthcare costs, that many patient financing options exist that involve lines of credit and interest and third-party collections. But I'd like to talk with you about built-in patient financing technology that really does keep the relationship between the dentist and the patient. The office can use automated payment plan technology to make it easier for patients to pay and encourage them to elect treatments they may not be able to afford, but can if they can pay it down over time. And practices can help ease this financial stress by using this type of methodology and breaking healthcare payments into fixed installments and collecting against the total at regular, predefined intervals. But the most important part that I want to mention here is that you don't need to do it through manual processes. So payment plan technology, right? Payment plan technology that's linked to a debit card, FSA, HSA, or credit card on file gives a provider a practical solution to work with patients who are unable to or can't make a lump sum payment. So offering patients the ability to make an initial smaller payment over time increases the practice's likelihood of collecting in full. So this is especially effective for larger payments and larger bills, whereby this option to break it into smaller chunks increases the propensity to pay. I should pause here and just mention that, there are a lot of different ways to do this, and there are a lot of offices who shy away from this practice. What we're seeing in the industry, though, is a very compelling situation called buy now, pay later. And that is, I don't know if anyone has seen it, but if you go to check out on any typical website these days, you'll see a little blurb that says you can pay over time. These are the types of trends that we look at and we say they're headed towards healthcare. It's just a matter of time. So I offer this to you on the front end of that so that we can consider offering payment plans to make payments manageable and allow patients to even be incented to start treatment they may not otherwise be able to or hesitant to begin with. This serves to increase satisfaction and loyalty. And I also believe that it makes for a good business model for providers. When you use this technology and built-in payment plan capability, you can offer these flexible payment plans without having to siphon off revenue onto a third party, without depending on collection companies, and offer this in a very caring and compassionate way to your patients. By not adding on more interest, you're actually helping them in the long run to get that care that they need without burdening them with a financial implication. And patients are looking for these types of options at checkout or before they go forward with treatment, as shown in the statistics here. I do have a success story for you to share. One of our practices, not only talking about what it's like on the patient side, but also from her perspective, which was that when she set up this automated monthly payment plan with her patients, she doesn't have to call them anymore. This is an office in Illinois, and what they did was essentially a lot of follow-up for 90-day plus balances when patients would elect to go down that route, and then they would have to do a ton of manual effort to get back in touch with them to make sure that they were paying. Because it was all manual, they would have to call the patient to actually collect the payment, which is not a very efficient way to do it. So when they were able to implement an automated monthly payment mechanism, she didn't have to worry about calling them anymore. And the card runs monthly without manual effort, and everyone is a lot happier for it. I'd be remiss into mentioning one more time that these pre-care, point-of-care, post-care technologies I just discussed really does affect patient loyalty, and it really does create a digital-first patient experience that they're looking for. There's no shortage of options. They will take to the internet to look for providers at a whim and are willing to shop around. And I think that what our consumer study illuminated was that these digital options, digital communication, payment methods, they're no longer nice to have. They're really key factors in making a patient more loyalty to the provider and to the practice, and making sure that this convenient modern experience that they're searching for is available to them. And one of the things that we hear often is, how do we tell patients to use this? Will our patients use it if I employ it, if we go down that route? And we're going to talk about that in a couple of slides. Please know that this technology really does also serve the practice and the staff, freeing up time, to allow the staff to focus on making sure that callbacks are made, that people are coming in. These automated processes really do have a positive effect on staff morale. And I just can't stress that enough, that sometimes that's overlooked. And we've heard really nice things about that benefit. And I have a quick quote for you just to see, as we think about how often, we focus in on the patient, but also how beneficial this is to the staff. And it also does serve as a way to remove manual error. So when we make things more efficient, we also increase their accuracy, and that means there's a benefit on the reconciliation side and the reporting side. We have up-to-date information, we have the correct information plugged in, and so that overall AR is reducing and processes are increasing in speed and in accuracy. I wanted to share some information about security. Now, I recently attended an event, and I know this is probably sometimes things that are on everyone's mind, but it's not the most common thing to talk about. No one really likes talking about risk, but we're going to go through it, and I'm going to share some things that I learned that I think are very important. Because as we increasingly rely on technology to improve workflows and connect with patients, mitigating cybersecurity risk becomes another top priority. And half the battle of implementing protective measures against these types of threats is recognizing what issues need to be addressed and how to best prevent them from occurring. Human error has surpassed malicious activity as one of the most common areas of threats and risks. So we're going to discuss how to be aware and how to proactively deal with the risks that can save your organization from security issues. So there's a lot going on this slide, so bear with me. I'm going to share a lot of information with you. Just to level set, in 2021, the healthcare industry was paid the most in fees associated with data breaches. And according to statistics, the average total cost increased from $7 million in 2020 to over $9 million. So wanted to run through some pressing threats that you can monitor and work to prevent. The first one is called misdelivery. It's the common most cybersecurity issue for healthcare organizations. And what this means is when internal stakeholders mistakenly send patient information to the wrong recipient, whether by traditional mail or email, and the staff has many pieces of information to send. It's not unfathomable that there are some errors that can occur, but when this misfire happens, it's a HIPAA violation and it can result in a breach because it can fall into the wrong recipient's hand and the practice loses that confidentiality that's associated with the communication. That's one. Hacking and IT incidents is another one. This is the category that ransomware falls, and it's a persistent challenge for everybody and for healthcare organizations. Since the onset of COVID, ransomware attacks have soared. And what it is, when we consider ransomware, it's criminals that are motivated by substantial financial gain. Ransomware is a type of malware that encrypts files, rendering them inaccessible until the ransom is paid. Literally, ransom is paid. And I, again, hate to paint a very negative picture, but these are really important things to be aware of. Insider threats also are another one. From human errors made by staff to malicious attempts to access and sell patient data. These internal actors often bypass traditional security protocols, either by mistake or with malicious intent, but these breaches are costly and difficult to anticipate. According to the Center for Internet Security, these insider threat encompasses including employees, from those who unknowingly click on a link that compromises a network or loses a work device that contains sensitive data, to those who maliciously give away access for the purpose of selling confidential data for profit. Along those notes, phishing attempts often disguise themselves well. You probably get spam to your phone, spam to your email, spam all the way around. They often include links that look authentic, but they're in fact malicious. And these phishing attacks can be through email, websites, and they are often looking to solicit personal information by posing as a trustworthy organization. And when you actually click through it, that's when the attacker gains access to, again, accounts or personal information. So what you want to do for these is to encourage your employees to make sure they question and verify a website or email sender before they do anything. Say something when you see something. Don't click on links. Training is very important when it comes to security. And while all practices are at risk, some are more protected than others. And when it comes to security, it's well worth your investment of time, energy, and finances. And one thing that I learned about is that there actually is cybersecurity insurance. I don't know if you all know about that, but evidently this coverage can help with theft or destruction of assets. It could also help recover identities and data that has been compromised. So that's just, I offer that to you as something that I learned along the way. And I, again, always consider leaning on your vendors for this help. Additionally, there are some things that you can do because obviously insurance can't prevent human error. So if your internal team is vigilant about verifying recipient information before, they keep passcodes up to date, avoid the temptation to click on any distrustful link. And according to our PCI Standards Council, the best protection against data breaches is not to store data, especially card data, payment data. Because we're talking about patient payments, I would be remiss if I did not tell you that this list includes what to protect: card readers, point-of-sale systems, networks and access routers, payment card storage data and transmission, and bringing to your attention payment card data stored in paper-based records. You never want to write down a credit card on a piece of paper, and online payment applications. So just making sure top of mind when you're thinking about payments you ensure that those are maintaining HIPAA and PCI compliance. There's a couple other notes here too for your information, and I also want to bring these security and trust symbols to your attention. Whether you accept or process payment cards, these data security standards apply to you. And a website I recommend is called PCI Security Standards. They work to monitor threats. They help to improve the industry's means of dealing with them, and they have some really great user-friendly data that you can create your own training or even just use for your own knowledge base and to share. So moving along with the challenges that we face to implement patient payment technology, and some of the technologies that we just talked about, is that for some groups, the perceived burden of this implementation is time-consuming, and it creates hesitation from moving forward. You might know there's a need in your office, but you don't even know where to start. So we gathered some experience and advice from providers that I'd like to share with you, and also from a leading dental practice consultant on what practices can expect when they begin researching and implementing new technology solutions. First up, to identify the needs of your practice, look at your cash flow. Oftentimes we hear from our practices, oh, we don't have a problem. And that's just because they don't recognize a way of doing business is not just because it's working doesn't mean that there aren't improvements to be made. And if you're sending paper bills, to me, that means that there's AR on your books and that you can solve that through digital payment-friendly methods. Listen to team's input. I think one of our doctors said it really well was, he said that to give up the old ways and the administrative aspects of the practice was tough because it always worked. That there is a process of letting go of some things. And when you identify those needs, you can really start to think about what kind of vendor would help you and what kind of technology could we use to outweigh any convenience or any trepidation. Oftentimes, practices reflect on making these changes, saying that they wish they only could have done it earlier. So taking the time to think about the vendor setup, troubleshooting, training that is provided for you, I think it would really be helpful if you lean on them for that, so that you're not taking all of this on yourself. Because what we also see is that after your practice has identified the need, shopped around for solutions, the next thing is just to really think about the time, money, and brain power to undergo this transformation. But if we treat it as a top priority and harness that same drive and determination that it took to adapt in how you ran your business over the last year, I think it will solve itself to adopt new revenue cycle management technology. I think you'll be very pleased with the benefits if you keep going and making sure that you're implementing the technology, working with the vendor, coming up with a plan, and then really when making the transition, considering how to roll out training. This consultant had mentioned that, splitting up the time and allowing for Q&A, but also setting some realistic expectations. So as we wrap up today, I think one of the things that for me, I'd like to impress upon you that, we've seen the digital transformation, the acceleration of it, the transformation of it. I think we know that patient expectations have changed and the overall industries are moving toward embracing a consumer-centric payment model. It certainly has felt that our overburdened healthcare system was thrust into utilizing technology, not only to make things more efficient, but to ensure physical safety. So we encourage you to now leverage that technology and take your practice to the next level with patient satisfaction and the improvement of cash flow. I think one of the most important things to remember when I look at this slide is that while we solve to capture more patient payments at all points of the care journey, we sit and come beside you to make things more efficient at the practice, have accessibility to more comprehensive reporting and reconciliation practices. It's easy to feel overwhelmed. I think you can start slowly, tackle the areas that are the most burdensome. So for example, if you have a high amount of AR, consider adding in text-to-pay options to expedite getting paid. If you have patients who don't pay their paper statement bills, consider offering them the option to pay online, having a payment link on your website. But most importantly, as you think about technology, it is not necessary to implement an entire digital strategy at one time. You can layer this in. You can make it such that it is not an overwhelming experience to the practice and a shock to your workflow. As I wrap up, I think about these parts of the technology and payment experience that each dental practice can leverage to reach these new levels of profitability and efficiency and satisfaction. I read this quote this morning. It said that successful outcomes are never the result of a single choice, that they're built up through good choices over time. And the writer was a healthcare constituent, and they said, building a profitable business over time is never a choice. It's a series of choices. So it truly is my hope that as you reflect on what was discussed today, that you can consider one choice that you can make to start with, to build up to accepting more patient payments or expediting the receipt of those patient payments. And these small choices or singular choices will pay off over time. And think about how you can start small. It doesn't need to feel overwhelming. And many times it really is as simple as making sure that your patients know what options they have. Oftentimes we hear people ask us, and I'm seeing a couple of questions come in about what happens if your patients, if I don't have a patient base that isn't tech savvy enough. Well, some need to just know that it exists, and then they will start to adopt it. And we hear from all types of practices all the time that more people use it than they would think. So as we wrap up and head over to a Q&A portion of this conversation, I wish you all of the continued success, and thank you for all of the work that you do to keep us safe and to keep our smiles healthy. And with that, I'm happy to take any questions that you may have.
Hey, Michelle, great presentation. Thank you for that. We do have a few questions for you.
Sure.
Okay. The first one, is it legal to store credit card information?
Well, legal and secure. I think the fact is that you want to work with a vendor who does that well for you and stores credit cards in a very safe way so that that data is not accessible to people. And it is something that protects your practice in order to, like we talked a little bit about on the security piece, you don't want to open yourself up to vulnerabilities like that. So I feel that really to think about that is you want to work with cloud-based technology and vendors and make sure that you ask those questions when you're considering how to store it in the most secure way possible.
Great. We have a good one here. Financial barriers to entry with electronic payment solutions. What should a small one-dentist practice expect to invest in order to take a few basic steps forward with electronic payment solutions?
I love that question because I really hope that small choices can be very big when it comes to collecting financial outstanding balances. So if I could impress upon everyone on this, it's making sure that your website has the ability to take payments. That's online, it's safe, they can put in just a few pieces of data that can get your practices paid quickly. So that one is very patient facing as well, so that you can add your website. You can just even verbally tell a patient that they can go on the website to pay for their care. So especially when you're thinking about from a small practice perspective, you should have, if you have a website presence, you could even just have a homepage that has the hours, your contact information, and you can put a pay now button on there. And that's one small basic step for a digital experience.
Great. Okay, we got another one here. It says, why are you not concerned keeping a credit card on file with the advent of hackers gaining access to patient credit cards?
For credit cards on file, I think that, again, it goes back to the idea of making sure that it is not stored on any of your systems. And through cloud-based technology, those credit cards are encrypted. That's the whole point of using a vendor that is, as I mentioned in those security and trust symbols, that they have all of those things, that they check all of those boxes. Those are the highest level of security from a payments perspective and from a HIPAA perspective. You want to make sure you're working with vendors who subscribe to all of those trust symbols. I'm sure everyone on this call has used a website to make a payment. most of us subscribe to Amazon, and that is considered a card on file. When you put your credit card on file with Amazon, that is the same terminology as card on file. But again, it's using the vendors that have the lock, the security symbols, and subscribe to P2PE, PCI, HIPAA, EMV. All of those components are so important to making sure your practice is secure.
Great. Here's another good one. How do you work with existing patient payment tools to not disrupt a practice's workflow?
That is a great one because, again, it goes back to when we think about how to incorporate digital methods. It's a disruption, right? It's a change to how you do business every day. So technology the best technology should feel invisible. It should feel habitual. It should be something that becomes so ingrained and part of your muscle memory that it doesn't disrupt your workflow. Yes, it's a difference. You might have to click a different button or talk to your patients for the first time about a different way they might be transacting with the office. But from then on, it should feel completely seamless and invisible. That is the beauty of working with digital methods, is it should be happening so frequently that you just do it, and all of a sudden those headaches are gone, the burdens are gone, that friction is gone. Thank you, Brian. That was a good question.
Great. We have one more. How can we achieve the goal to reach more patients via technology successfully?
Awesome. This is probably one of the biggest questions that I get is, how do we help patients utilize technology? How do we make it worthwhile? So there's a lot. Another big trend is called QR codes. You know, it's that kind of like the little square that has like all the messy little data in it. What we've seen is a lot of practices are using that not only to take payments, but also communicate, because that QR code can drive to any landing page on a website and basically give people information. So what becomes very interesting is that there are all of these ways that we can reach our patients. The most important is to let them know how they can reach you, how they can pay, how they can make appointments, what to do if they need to cancel or reschedule. And when we think about technology, and we think about how quick a text message is opened and how often it's read, if we can make it bite-sized so that patients can get and absorb information quickly and easily in the way that they want to, meaning digitally through their phones, because that's what everyone really does connect with the most, I think that's where you can start to see more and more adoption in digital methods and overall technology.
Thanks for your insights, Michelle.
Of course.
Now we'll be providing information on how to redeem your CE credits. You should see on your screen now, claim the CE credit slide. First, be sure to write down the code from today's event. That is REC 102021. Again, that's REC 102021. You'll need this code to claim your credit. Please remain logged on and you will be redirected to the correct site to claim. Within 30 minutes, you will also receive an email with this information. On behalf of the Dental Academy of Continuing Education, Endeavor Business Media, and Rectangle Health, we thank you for joining us today and look forward to serving you with more webinars in the near future. Good day.